everybody. This filter actually makes me look like I have makeup on and that I look healthy. I have no makeup on my face. I barely brush my hair. I'm homesick and I'm not good at just sitting here trying to get better. And I can't sleep right now. So after this, I'm going to try to get some food down my hatch and go to bed. But I do want to talk to people out there like me who struggle with kidney issues or UTIs or yeast infections. Women, I get at least 3 UTIs a year and at least 3 kidney stones a year. Very briefly, I was born with a defect, so there's a tube that connects your bladder to your kidney, and mine is stunted. It didn't grow big enough and or wide enough, so it never gets my waste out fast enough, which creates stones, creates UTIs, yeast infections. In anybody, this is a common birth defect. My cousin had it, my brother had it. They both had the surgery to fix it, but mine was caught too late, and the surgery is extremely invasive. Basically, there's a piece about that yay big that goes in your tube, and it acts like a channel. Like it closes so that it can't fill up your tube and just sit there, but it flushes, it keeps, I don't know exactly what it does, but it keeps things moving in that tube so you don't get backed up. The whole point of that is to prevent kidney stones, prevent your kidney from malfunctioning. And why my kidney malfunctions because it gets backed up with fluid, it gets backed up with infection. And when your bladder or kidney gets infected, it swells, which puts pressure on your bladder and other organs. Why you always feel like you have to pee and you go pee and only a drop comes out. It's because your bladder and your kidney are swelling, or you're collecting a lot of water weight, or it's just a symptom of an infection. So I am allergic to penicillin and amoxicillin, so they give me a Z-Pack. And anybody who is like me, the Z-Packs stop working. It's the only antibiotic that I can have, and they give it to me for everything, whether it's strep throat, a kidney stone, or COVID, like whatever. They only are allowed to give me one antibiotic because of all of this and because of my allergies, and my body is immune to it. So Z-Packs do not work for me. They have given me a few pills, and all of them made me itch. They were some kind of knockoff version of amoxicillin. I know that when I was younger, I had a problem with penicillin. It's just hives. I itch. I can tolerate it. Like, I can have it in my body without dying. It doesn't put me into a shock. But who wants to be uncontrollably itching for 7 days or however long you're on that medicine? Because as long as it's in my blood system, I just feel like there's bugs inside my skin. It's so fucking annoying. So I'm just not willing to go through that. So I found a lot of holistic things that work. My mom turned me on to hibiscus tea. Hibiscus tea is great for kidney and bladder problems. Drinking that every day. I've heard that apple cider vinegar. Apple cider vinegar? Apple vinegar? Is it apple cider vinegar? I think it's apple cider vinegar. The pills, though. Don't drink it straight. Like, they make pills. You can even get them at the Dollar Tree. I don't like taking those every day, though, because it makes me feel sick or it triggers my anxiety. So I take that maybe once on Monday and once on Friday. But it is also helpful for losing weight. These are the things that I have been living by and have really fucking helped me more than this fucking antibiotic. First of all, AZO is an affordable company. You can get most of their products range from $5 to $7. I feel like they are made for people like me who can't afford to be going to the doctors as many times a year as we do. We get so many UTIs and infections. We can treat them at home when we have products like this. But this is the best thing to take all the time. Put this in with your vitamin regimen. You take 2 every day with a full glass of water, and it will keep those infections away. I actually stopped taking this for a while, and I think that's why I got stones again. But it cleanses and protects you. cranberry extract, urinary tract health. 1 serving, 1 glass of cranberry juice per pill. So you're taking 2 a day. I don't like cranberry juice, it's too bitter, so this is the easier way for me to do it. But drinking cranberry juice every day. I've been drinking ginger ale, the cranberry ginger ale. It's delicious, by the way. Canada Dry makes it. They also have blackberry ginger ale, which is very good, and they have fruit punch ginger ale, which is awesome. Just putting it out there. These things are fucking amazing. I got these at Walmart. They're a little bit, I think they were like $10 or $11. You're supposed to take 4 gummies a day. I find if I take 4 gummies a day, I feel like shit. So I normally take 1 gummy a day, and I just put it in my vitamin regiment. But if you have an infection, take those 4 that day, every day of your infection. This flushes. It says urinary tract health. D-mannose gummies cleanse, flush, and protect the urinary tract. That tube that gets backed up for me, that causes all those stones, and this is a common birth defect, and people who have kidney failure, it all starts in your tube. So just keeping your tube healthy, these gummies can do that for you. Again, I take them every day, just 1, but they do recommend you take 4. Anytime I have an infection, I take 4. This gets my infection moving. It gets it out. I do get cramping, but I don't take that as a bad sign because I'll have 1 or 2 days of cramping and then my infection is gone. To me, this is just, the cramping is my body getting cleaned out. It's a little bit painful getting over these infections. Always take ibuprofen, or Motrin is the best if you can't handle it. I take this every day too, cranberry gummy. So yes, I take these 2 pills every day, and I chew a gummy. I don't fuck around with my kidney, or I would have way more infections than I do. This is how I've kept my kidney healthy for 40 years and kept me off a donor list or having to have it be removed. I find holistic healing to be far more beneficial than any antibiotics. Anytime I take an antibiotic, I get sick. It messes with my stomach. I can't eat food. And anybody has that reaction to an antibiotic. It's highly invasive, but you do need antibiotics for certain things. I'm not against them. I'm not against Western medicine. I just think they overprice, they over-medicate, and these things you can go to the store and treat yourself. Unlike me, who's going in week 2, I should be going to the hospital. I should be getting a sonogram done. I should have my pee tested. I should be checking to see if I have something more serious. But every time I go to the ER, because I do not have insurance, I'm walking out with no less than a $10,000 bill. I make like not even $2,000 every 2 weeks. How do they expect people to afford that? And half of the time you're in there, by the way, you're not seeing a nurse, you're not seeing a doctor, you're just sitting there. I talk to a nurse. I'll be in the hospital for 9 hours. I will talk to a nurse maybe an hour of that, and I will talk to a doctor for about 15 minutes. And they charge that astronomical amount of money, and they test you for everything under the sun, even though they know it's not related. You're just a money-making machine to them when you come in without insurance, and they do take advantage of you. Also, an ambulance ride is $20,000 without insurance. Just getting you to the hospital is $20,000 just to save your life. And then what? You're in debt forever? Most of my debt that I do have is medical debt because I was born with things that I can't control, and this country sets you up to fail. Companies are no longer giving insurance out most of the time. It's very hard to find a place that does offer you vision, dental, and health. You either only have health or you only have vision and dental, but not health. They used to offer packages which helped people stay on top of their health and get to see a doctor when they need to. They're popping up all these little well-now places, little urgent cares, but none of them will touch you without insurance, and they pick and choose what insurance they will be allowing. So even if you do have insurance, you could go there and be seen in an hour, get in and out, if they like your insurance company. This country is killing people with their money hungriness and their negligence and their lack of doctors.